When you hear the word amputation, what comes to mind? For a lot of us, it probably sounds like an ending, maybe even a failure of medicine. But what if it's not? What if, for many people, it's actually the starting point, a reconstructive journey? Today, we're going to reframe this whole idea and look at how this procedure can be a path toward a new functional life. So let's just start with a number to get a sense of the scale here. 60,000. That's how many major lower extremity amputations, we're talking above the ankle, happen every single year in the United States. It's a huge number, and it really shows you just how significant this is for thousands of patients and their surgeons. And this quote, this really gets to the heart of what we're talking about. It challenges the whole perception of failure. The idea isn't just about removing a diseased limb. It's about reconstructing a new foundation for a patient's entire life. And, that shift in perspective, it changes everything. Okay, so to understand why amputation is considered a treatment, we first have to back up a bit and look at what leads to it in the first place. Because these aren't just random events, they're often the final step in a much larger and growing health crisis. The two main drivers here are diabetes and peripheral artery disease, or PAD, and they're a nasty duo. They often go hand in hand. Diabetes can lead to what's called neuropathy, basically nerve damage that means you can't feel your feet properly. You combine that with a higher risk of infection, and it is a massive, massive factor. In fact, if you have diabetes, your risk of amputation is 8 times greater. 8 times. Now, there is some good news. For a long time, the trend was heading in the right direction. Thanks to better awareness, better wound care, better medical management, amputation rates were steadily going down. But look at the chart. Right around 2009, that progress kind of hit a wall. It's plateaued. And that tells us this fight is far from over. And that brings us to what is, without a doubt, one of the most critical decisions a patient and their doctor can ever face. It's a true fork in the road, where each path has absolutely life-altering consequences. So here's the question. When a limb is seriously threatened, what's the right call? Do you go down a long road of complicated surgeries to try and save it? Or do you choose a primary amputation to solve the problem for good and start that process of reconstruction right away? On one side, you've got what's called limb salvage. Think things like bypass surgery or angioplasty to try and get the blood flowing again. But for some patients, maybe someone with a lot of tissue loss, a terrible infection, or who just isn't in great health, a primary amputation can actually be the better option. It gets them on the path to recovery and rehabilitation much faster. And the data really shows you the reality of this decision. In one study, more than half of all major amputations were performed after attempts to restore blood flow had already failed. Other big reasons? Extensive gangrene, which is just dead tissue, or overwhelming sepsis, a really bad infection in the foot. At that point, the limb is often just beyond saving. All right, so once that incredibly tough decision to amputate has been made, the next question is just as critical. And we're talking about a matter of millimeters here, figuring out the exact level for the amputation. The goal for the surgeon is this really delicate balancing act. You want to save as much of the limb as you possibly can, right? Because that maximizes a person's future function. But, and this is a huge but, you have to amputate at a level where there's enough blood supply for the wound to actually heal. If you get that balance wrong, it can mean more surgeries and a much, much tougher recovery. So how do they find that sweet spot? Well, it's a mix of art and science. A huge piece of it is just the surgeon's experience and clinical judgment, feeling for pulses, looking at the skin quality. But they also back that up with hard data, using objective tests that measure things like the oxygen pressure in the skin. No single test is perfect, so it's really about putting all those pieces together to get the full picture. And this, right here, is why that level is so incredibly important. Think about the energy it takes you to walk. With a below-knee amputation, that energy cost goes up by as much as 40%. But if you have an above-knee amputation, that can jump by a staggering 70%. That's like turning a casual walk into climbing a steep hill. It's why preserving that knee joint is the absolute #1 priority. It makes a world of difference. The surgery itself, that's just one day. The journey that comes after is a marathon, not a sprint. And it takes a whole team of specialists all working together to help that patient find their new normal. This whole path usually takes about 12 to 18 months, and it's broken down into stages. It actually starts before the surgery, then moves through the hospital stay, then into the post-acute phase of healing. After that comes the really crucial stage, where the patient gets their first prosthesis. And finally, it's about stabilizing and getting back into their life. It is a long team effort. And we absolutely have to talk about the mental and emotional side of this, because it is profound. The psychological impact of losing a limb has been compared to grieving the death of a spouse. Depression is incredibly common. But here's the crucial thing. Successful physical rehabilitation, getting a patient up, moving, and regaining their independence is one of the most powerful ways to fight that depression. So for our final section, let's zoom out, because the decision to amputate and what happens after doesn't happen in a vacuum. It's all tied into a complex web of societal issues, and the future holds some pretty big challenges. When you dig into the data, it becomes clear that the risk isn't shared equally. Studies consistently show that things like your race, your income, and your insurance status are linked to higher amputation rates. For instance, even after you account for diabetes, Black patients are more likely than white patients to have an amputation instead of a limb-saving procedure. And what this all points to is a tough, systemic reality. Where you live and the kind of healthcare you can get really, really matters. We know that regions with more vascular specialists have lower amputation rates. A patient's outcome can literally depend as much on their zip code and insurance plan as it does on their actual medical condition. And the need to solve these problems is getting more urgent every day. Why? Because with our aging population and the ongoing epidemics of diabetes and PAD, this is the projected number of people in the U.S. who'll be living with limb loss by the year 2050. 3.6 million. That's more than double the number we have today. So, we end with this question. If we truly believe that amputation is a reconstructive treatment, that it's a path to a new functional life, then how do we fix the system? How do we address these disparities to make sure that everyone who needs this path has a fair shot at the best possible outcome?